Everybody, welcome back to theclinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. Really quick video. I'm obviously on the go, so I'm not in my studio, and I don't have my GoPro with me, so I'm using my iPhone, but it's the iPhone 6, so hopefully it does a good job. So today's question comes from a brand new research clinic, and they're actually a client of mine, and they have one PI and one business person, and what they're doing, they prefer to do a certain type of clinical trial, but right now it's really slow in that particular niche. So I'm trying to convince them to be willing to take on general medicine studies. And of course, the first thing they bring up is, hey, I need help with the recruitment. Well, a simple study like an asthma study or a constipation study or a lower back pain study or a headache study, there's enough of those out there right now, and there's enough people with those conditions in just about any city for you to put up a couple Craigslist ads, a couple Facebook ads, network with a couple of doctors in your area, and do a good job or a decent job of recruiting for your trial. I mean, that's how a lot of the sites do it. Many sites that take on general medicine studies are actually specialists that are specializing in other indications. Like one of my sites, we have a psychiatrist as a PI, but because psychiatry is a little slow right now as far as clinical research is concerned, and this is June 2015, I'm hoping that'll pick up later. He's taken on a lot of general medicine trials, and he's doing just fine. It's not his specialty, but what he did was he contracted with sub-investigators. So he found family practice doctors in the area that do see those kind of patients and has them refer the patients to his clinic, and then maybe he'll have them do some of the procedures that they typically would do for the study, because a psychiatrist really wouldn't know how to do some of these procedures. So that's what you need to do. I mean, if you're in business, the harsh reality is, yes, we all want to do what we're best at all the time, but you have to adapt to what the market gives you. You have to be willing to counterpunch. Right now, if there's a lot of general medicine studies, but not a lot of studies in your particular therapeutic indication, guess what? Either you got to convince your PI to do them and let them know that you'll help with their recruitment, and you'll find other doctors in the area that can refer or be sub-Is, or if your PI is still hesitant, go find another PI for those kind of trials. There's a lot of them, especially the generalists out there. There's a lot of family practice physicians that wouldn't mind being a sub-investigator, some of them even a principal investigator in a clinical trial. So here's what you do, because when a sponsor comes to do a site selection visit at your site, they're obviously going to ask, well, how are you going to recruit these type of patients if your specialty is this? So what you want to do, what you want to do is pre-identify study participants, whether it's from your referring physician's practice, from the community, like from Craigslist. If people are already calling you, you can have them come in and sign an authorization to release records, and you can request their medical records from their physicians, or from Facebook ads, or however it is you can get them, but preferably from the physicians in your area that do see those patients that are willing to refer them. So you want to get at least 15 to 20 pre-identified subjects for that particular trial. You want to de-identify their identifying info, like their name, social. You don't want that. You can put their date of birth, and their initials, and what condition and what medications they're taking. And you can show this, you can store this. I prefer, and all my sites use Intralinks Via. They're actually a sponsor of the Clinical Trials Guru, but I've been using Intralinks for over 6 months now. All my sites use it for a lot of other things, including pre-identified study participants. And what we do is we keep them stored on Intralinks internally for our purposes, so that we have their information readily available. But another good thing it could be used for is a marketing tool for SSVs, for site selection visits. So prior to the monitor coming out to your site for a site selection visit, you want to be able to share access with them, which you can do with Intralinks. All you do is invite them via email, and they could look at your pre-identified patient log, and they can see that, okay, this person went out of their way to do their homework, and they've already identified 15, 20, 25 study participants that may or may not actually qualify, but we can see that they're actually able to get some study participants. So this will give you a lot more clout when they actually come to your site selection visit. And when they do come, of course, you'll print out your log and give it to them. So just a little hack that I've been using especially for my sites that are doing studies that they're not specialized in doing. Because we're all in business, we're all here to make a profit, and it's our job to remain in business until the studies that we actually want to do come around, or the studies that we're actually good at doing come around. So in the meantime, we got to take what's out there, we got to react to what the market gives us. So try this hack, try these things that I mentioned, and see what happens. This is Dan from theclinicaltrialsguru.com. Take care.